Okay, if you're a public health professional, let's just get right to it. Your job has completely changed. See, it's not just about having the right information anymore. It's about actually being heard. So today, we're going to build out your modern communication toolkit. Let's dive in.
Here's the core shift, the big idea you have to wrap your head around. It isn't enough to just have the facts. You have to somehow capture and then hold on to the public's focus in this just endless sea of digital noise. Your biggest competitor isn't even misinformation. It's just plain old distraction.
And this brings us to a concept you really have to master. It's called the attention economy. Now, this isn't just some marketing buzzword, it's the new reality. It's the landscape where public health battles are either won or lost.
This quote, which actually comes from business theory, just frames our modern world perfectly. Attention is a scarce resource. You can think of it like a currency. And, well, just like any currency, you have to compete for it.
You can really see that fundamental shift right here on this slide. We've moved from that old one-way broadcast model, the megaphone approach, to this complex, real-time conversation. Broad, general messages just get lost now. Success today demands targeted, tailored content. This is exactly why your toolkit has to evolve.
All right, so let's start building that new toolkit. The first tool we're going to grab is probably the one you're most familiar with, but maybe you're not using it to its full potential. We're talking about social media. It really is the foundation of any modern communication strategy.
So how do you actually build a campaign that works? Well, the Journal of Medical Internet Research gives us this really clear evidence-based framework. You see, it's not just about posting. It's about tailoring your message, involving your community in the design, actively fighting misinformation, encouraging people to share, and, this one's so important, actually measuring what happens in the real world as a result.
And this table here kind of breaks down the how. Every platform speaks its own language, right? For Twitter, you've got to be concise, visual, and connected. Instagram, that's all about strong visuals like infographics. And then blogs and podcasts, those are your spots for the deeper dives and more scholarly discussions. The whole key is to match the platform to your specific goal.
And of course, there are some rules of engagement. Your online presence is a reflection of you and your institution. It's about building a positive space, lifting up the work of others, and having a conversation, not just giving a lecture. And, part of that means expecting the negative and being ready for trolls.
Okay, now let's add a seriously powerful new instrument to our toolkit, artificial intelligence. I really want you to think of AI not as a replacement for your expertise, but more like the most capable assistant you have ever had.
And that's a fair question, right? How does this cutting-edge tech actually plug into the day-to-day work of public health communication? Well, the answer is pretty cool. It basically amplifies everything we've just talked about.
So first, let's make sure we're on the same page. We're specifically talking about generative AI. This is the tech that can actually create new stuff. Text, images, you name it, all based on the massive amounts of data it's been trained on.
I mean, just look at these applications. AI can help you draft social media posts. It can summarize a super dense 50-page report into clear bullet points. It can translate materials for different communities. It can even scan your own work to pull out the most powerful quotes for a campaign. See, this isn't about replacing you. It's about freeing you up to do the high-level strategic work that only you can do.
But of course, a tool this powerful, you can't just use it without some clear guidelines. So think of this next section as the essential user manual, the ethical framework you need to put AI into practice responsibly.
I want you to think of these 5 principles as your North Star. These are the fixed points that have to guide every single way you use AI in your work. They ensure that this technology is always serving your core mission, to protect and improve public health. First up, you've got this dual responsibility. It's a balancing act. You have to protect personal and private information at all costs, but you also have to be transparent with the public about when and how you're using AI. This is absolutely fundamental to keeping their trust.
Okay, this one is so crucial. The AI is not the author. Your organization is. At the end of the day, you are responsible for every single word, every single fact. Every piece of AI-generated content has to be rigorously vetted by a human expert. No exceptions.
And that leads right into principle 3. AI is an incredible tool, but that's all it is, a tool. Human judgment, context, and ethical oversight, they aren't just important, they are completely irreplaceable. AI assists, but you decide.
We have to make sure these new tools are closing health equity gaps, not making them wider. And that means being constantly vigilant about bias in the data AI is trained on and in the content it creates. The goal has to be using AI to serve all communities, especially the most vulnerable.
And finally, this is not a one-and-done kind of thing. AI technology is evolving at an absolutely breakneck pace. Using it ethically means you have to commit to constantly testing, learning, reviewing your own processes, and just staying informed.
Okay, let's make this real for a second. Imagine you use a generative AI tool to help you draft a fact sheet about COVID-19 vaccines, and it's specifically for new parents. It's a fantastic starting point, right? It gives you a solid structure, pulls some key facts.
So what's the ethical move here? You disclose it. That's it. A simple little note on the fact sheet or on your website that says something like, AI was used as an assistant in creating this document. It respects the public, it maintains trust, and it's a perfect application of Principle 1.
So, after all this, what does it mean for the future? Well, we're at this really critical point where mastering these tools isn't just a nice little add-on. It's becoming a core competency for effective public health communication.
And if you ever for a second doubt how important this is, just remember this number. 72% of adults in the U.S. are using at least one social media platform. The public is already there. The only question is, how effectively are we going to meet them there with credible, engaging, and life-saving information?
And this brings us right back to where we started. Success in this new world isn't about managing your time better, it's about mastering the art and the science of managing public attention. That is the new core skill.
And so, I'll leave you with this question to think about. As these tools get even more powerful, and they will, how will you, in your role, make sure that they stay tools in service of your public health mission and not the other way around? The future of health communication really depends on your answer.